Hi, my name is Suchit Patel. I'm a radiation oncologist at Renown Health. I got interested in healthcare at a very early age, probably sometime towards middle of high school or end of high school when I took my biology class. I thought it was cool science, cool stuff, and that ultimately led me down to biology, which led me to healthcare. You know, my philosophy is really focused around doing what's right for the patient. We see a lot of people in very vulnerable situations with very serious illnesses, and we want to make sure that we're doing the right type of medicine for the right patient. Sometimes that means meeting the patient with their goals in mind and trying to figure out what makes sense for each individual scenario while keeping in mind sort of the best practices and the guidelines and the stuff that we're supposed to be doing. What I like best about my job is that I'm able to help people at a very serious and difficult time in their life. You know, when I was choosing what to do in medical school and what I wanted to focus on, I have a lot of respect for a lot of other specialties, but what I like doing is seeing people and trying to help them navigate what is usually a very difficult time in their life. And, if we can do that successfully, then I think it goes a long way towards improving the quality of life that my patients have. I'm a radiation oncologist, so I see cancer patients, but we see a wide variety of cancer patients. I personally focus on thoracic cancers and CNS tumors or brain tumors. So I see a lot of patients who have lung cancers, who have cancers that have spread to the brain sometimes, other kind of serious illnesses like that. You know, to live healthier, the advice that I give my patients most commonly is to stop smoking. Most of my patients in the lung cancer world are smokers or were former smokers, and I tell them that, if you quit today, it's still better than not quitting. If you quit 2 years ago, great, good for you. But any time that you get the desire to quit and you can make that happen is a good time. In my spare time, I like to hike on the BLM land here. There's a lot of tremendous, beautiful nature trails. Our family is big into snowboarding and skiing, so we do a lot of that in the wintertime. And in the summertime when it warms up, we take our bikes out and hit the trails. Living in Reno, the best part is I have access to all of those things. I can be at the slope in 20 minutes from now. There's a lot of great scenery and a lot of great nature, and just exploring and enjoying all of that is what I like best. One thing my patients might find surprising is often they'll come in and they'll say, "How old are you?" or when did you graduate medical school? Or, something like that. And usually when I tell them how old I am, they are a little bit surprised. And then they say, "Wow, that's like my kids or my grandkids," because, but it is what it is.